You know that feeling when you wake up and your body just feels heavy? Not sick, not in pain, just heavy. Like somebody quietly turned up the gravity in your bedroom overnight. You drag yourself out of bed. You had 8 hours of sleep, a full, proper 8 hours, and you feel like you slept too. You look in the mirror and your face looks puffy, not swollen, just thick. Your eyes are a little smaller than they used to be. Your jawline is softer. And you think, well, that's just age, right? That's just what 55 looks like. Here's what I need you to hear right now. That is not what 55 looks like. That is not what 60 looks like. That is not what 68 looks like. What you're describing, what millions of people are living with every single morning, has a name. And it's not aging. It's not depression. It's not laziness. It's not just stress. In about 70% of cases, it's a tiny gland sitting right here at the base of your throat, shaped like a butterfly, weighing less than an ounce. And it is either screaming for help or slowly shutting down. And nobody told you. Not because doctors are bad, but because the system wasn't designed to catch this early. The system was designed to catch it late, when you're already on medication for 3 other things that were never the real problem. My name is Dr. Mark Tilden. I've been in general practice for 17 years, and I'm going to walk you through the signs your thyroid is struggling, the ones that don't show up on a poster in your doctor's waiting room, the ones you've been explaining away for years. Some of what I'm about to say will genuinely surprise you, and by the end of this video, you'll have a clear, practical, affordable protocol you can start this week. Not next month, this week. No prescriptions required for the first phase, just your own kitchen, a thermometer, and about 15 minutes each morning. One thing before we dive in, and I mean this, hit subscribe right now and tap the like button. We're pushing toward 500,000 subscribers, and this channel grows on one principle. The information your doctor doesn't have time to give you in a 12-minute appointment deserves a place to live. That place is here, and it can't grow without you. All right, let's get into the part nobody talks about. Now, I need to set something straight before we go any further. Nothing in this video replaces a proper clinical evaluation. If anything I described today sounds like you, and I suspect several things will, please use this as motivation to have a real conversation with your physician. Not to self-diagnose, not to panic, to ask better questions. That's what this channel is for. Better questions lead to better answers. All right? Good. Let's go deeper. So here's the thing about your thyroid. Most people think of it as a thermostat, and that's not wrong, but it's wildly incomplete. Your thyroid isn't just a thermostat. It's the conductor of an entire orchestra. Every single cell in your body has receptors for thyroid hormones. Your heart, your gut, your brain, your muscles, your skin, your hair follicles, even the speed at which you form thoughts. When that conductor is strong and precise, the orchestra plays beautifully. You feel sharp, warm, energized, your digestion works, your mood is stable, your sleep is deep. When that conductor starts losing the beat, even slightly, even by just 10 or 15%, every section of the orchestra starts drifting. Not crashing, drifting. And that's the dangerous part. Because drifting doesn't feel like a disease. Drifting feels like getting older. Let me give you the physiology because you deserve to understand what's actually happening inside your neck. Your thyroid gland produces 2 main hormones. The first is called T4. Think of T4 as a storage unit. It's the raw material. It circulates in your blood, but it doesn't really do much on its own. It's inactive. It's waiting. The second is T3, and this is the active player. T3 is the one that walks into a cell and says, speed up, burn fuel, build protein, stay alert. Now here's the critical piece most people never learn. Your thyroid produces mostly T4, about 80% T4, 20% T3, which means your body has to convert T4 into T3 to actually use it. And where does that conversion happen? Mostly in the liver, some in the gut, some in the kidneys. So already, you can see that thyroid function isn't just about the thyroid. It's about your liver health, your gut health, your kidney function, your selenium and zinc levels, your stress hormones. It's a chain. And any weak link in that chain can make your thyroid look fine on a blood test while you feel absolutely terrible. Let me say that again because it's that important. Your blood test can come back normal, and your cells can still be starving for thyroid hormone. This is not rare. This is not controversial. This is documented, published clinical reality. And yet, it's the single most common reason people spend years feeling awful with no diagnosis. Why does this happen? Because most standard blood panels only check one thing: TSH. That's thyroid stimulating hormone. Think of TSH as a memo from your brain to your thyroid. Hey, make more hormones. If TSH is high, it means your brain is yelling because the thyroid isn't keeping up. If TSH is low, the brain is relaxed. Normal TSH means the brain thinks everything is fine. But here's the problem. TSH tells you what the brain thinks. It doesn't tell you what's actually reaching your cells. You could have perfect TSH, decent T4 in your bloodstream, and almost no T3 getting into your tissues because the conversion is broken, because your liver is sluggish, because you're chronically stressed and cortisol is blocking the conversion, because you're low on selenium, which is the mineral that literally makes the conversion enzyme work. And your doctor looks at the TSH number, says your thyroid is fine, and sends you home with advice to sleep more and maybe try yoga. I've seen this happen hundreds of times. It's not malpractice, it's a system limitation. Your doctor has 14 minutes. The lab panel is standardized. The guidelines say check TSH first. And if TSH is in range, move on. That's protocol. But protocol doesn't always match physiology. And your body doesn't care about protocol. Your body cares about T3 reaching your mitochondria, the little power plants inside every cell that turn food into energy. When T3 doesn't arrive, those power plants dim. Not all at once, slowly. Like someone is turning down a dial one click per month. And here's the good news, and I genuinely mean this. That dial can be turned back up. In most cases, especially when we catch it in this early, subclinical, technically normal but functionally impaired phase, the changes required are not surgical, not pharmaceutical, and not expensive. They are nutritional, behavioral, and surprisingly simple. But you have to know what you're looking for first. So let's talk about the signs. And I'm not going to give you the list you've already seen, the one that says fatigue, weight gain, cold hands. That list is real, but it's the obvious list. I want to give you the signs you've never connected to your thyroid, the ones that made you see a cardiologist, a dermatologist, a gastroenterologist, a psychiatrist, when the answer was sitting in your neck the whole time. Sign number 1. Your eyebrows are thinning from the outside in. This is incredibly specific and almost never mentioned in popular health content. Look in the mirror. Look at the outer third of your eyebrows, the tail end closest to your temples. If that section is noticeably thinner than the inner part, or if it's essentially gone, that is a classic low thyroid sign. It's been documented in clinical literature for over 60 years. The mechanism? Thyroid hormones regulate the hair growth cycle. When T3 drops, the hair follicles in that outer eyebrow zone, which are the most sensitive to hormonal changes, go dormant first. It's a canary in the coal mine. And yet, I have patients who spent $200 on eyebrow microblading, and nobody once checked their thyroid. Sign number 2, and this one genuinely shocks people. You're constipated, but not the way you think. I'm not talking about going 3 days without a bowel movement. I'm talking about going every day, but incompletely. You go, but you never feel done. You go, but it's small, dry, pellet-like. Or you go, but 20 minutes later, there's more. This is not a fiber issue. This is a motility issue. Your gut is a long, muscular tube, and the speed at which it contracts and pushes content through is directly governed by thyroid hormone. Low T3 equals slow gut. Slow gut equals incomplete evacuation, bacterial overgrowth, bloating, and, here's the part nobody tells you, poor absorption of the very nutrients your thyroid needs to heal: selenium, zinc, iron, B12. They're all absorbed in the gut. If the gut is sluggish, you're not absorbing them properly. So the thyroid gets worse, which makes the gut slower, which makes absorption worse. It's a loop, a vicious, self-reinforcing loop. And it starts so gently that you don't notice it for years. Sign number 3. Your cholesterol went up and nobody can explain why. You didn't change your diet. You didn't stop exercising. You maybe even lost a few pounds. And yet your LDL, the so-called bad cholesterol, crept up 10, 15, 20 points. Your doctor might put you on a statin, and the statin might lower the number. But the number wasn't the disease. The number was a symptom. Here's what's actually going on. Your liver clears LDL cholesterol from your bloodstream using special receptors on its surface. Those receptors are activated by, you guessed it, T3. When thyroid function drops, even slightly, those receptors slow down. The liver stops pulling LDL out of the blood efficiently. Cholesterol rises. Not because you ate too many eggs, because your thyroid whispered, "slow down," to your liver, and nobody heard it. There is published research, and this isn't fringe, this is in mainstream endocrinology journals, showing that subclinical hypothyroidism can raise LDL cholesterol by 15 to 25%. That's not a trivial number. That's a number that gets people prescribed lifelong medication. For a problem that might resolve with proper thyroid support, sound familiar to anyone watching? Because if it does, and statistically for about 1 in 5 of you over 50, it will, I need you to type your age in the comments right now. Just the number, nothing else. I'll explain why in a moment, but trust me, that number helps me build this channel for you, not for some generic audience. For you. Your age changes the recommendations, the risk profile, the physiology. I read every single comment, and I use them. Sign number 4. You're losing hair, but not in a male pattern or female pattern way. It's diffuse. It's all over. You run your fingers through your hair in the shower, and there's more in your hand than there should be. Your ponytail is thinner. Your part is wider. And it's not just your head. You might notice it on your arms, your legs, your body hair thinning too. This is thyroid. The hair cycle depends on adequate T3 the way a plant depends on sunlight. Reduce the sunlight, the plant doesn't die immediately, it just stops producing new leaves and the old ones fall faster. Same mechanism. And this is not vanity. Hair loss causes real psychological distress, especially in women, and it's often dismissed as hormonal changes without anyone specifying which hormone. Well, I'm specifying it. Check your thyroid. And not just TSH, the full panel. We'll get to that. Sign number 5. Your mood shifted, but it's not depression. At least, not the way you've always understood depression. You don't feel sad exactly. You feel flat, like someone turned down the color saturation on your life. Things that used to excite you just don't. You're not crying. You're not hopeless. You're just existing, going through the motions. And maybe someone, a well-meaning someone, suggested antidepressants. And maybe you even tried them. And maybe they didn't really work, or they worked partially, but something still felt off. That off might be T3. Thyroid hormones cross the blood-brain barrier. They regulate serotonin receptor sensitivity. They influence dopamine pathways. They affect the speed of neural transmission. A brain running low on T3 is a brain that can mimic clinical depression symptom for symptom. And an SSRI won't fix it, because the problem isn't a serotonin deficiency. The problem is a thyroid hormone that isn't reaching your neurons. Let me tell you about a patient. I'll call her Margaret. 61 years old, retired teacher, sharp woman, funny. The kind of person who does the crossword in pen because pencil is for people who aren't sure. She came to me not because she was sick. She came because she was, in her words, becoming someone I don't recognize. She was tired all the time. She'd gained about 7 kilograms over 2 years despite eating less. Her skin was dry. Her hair was thinning. Her joints ached in the morning. And, this is the part that got me, she said she'd stopped calling her friends. Not because she was upset with them, she just couldn't be bothered. I used to love people, Dr. Tilden. Now I just want to sit in my chair. She'd been to her GP, twice. TSH was checked, normal, 2.8, right in the middle of the reference range. Your thyroid is fine, Margaret. She was offered antidepressants. She tried sertraline for 4 months. Minimal effect. She was told it might be perimenopause carryover. She'd gone through menopause 8 years earlier. She was told to exercise more. She was told to try meditation. When she sat in my office, I listened to her for about 25 minutes. And then I ordered a full thyroid panel, not just TSH. TSH, free T4, free T3, reverse T3, thyroid peroxidase antibodies, and thyroglobulin antibodies. The results came back, and here's what they showed. TSH was still normal, 3.1 this time. Free T4 was low normal. Free T3 was genuinely low. And her thyroid peroxidase antibodies were elevated, significantly elevated. What does that mean in plain language? Margaret's immune system was quietly attacking her own thyroid gland. It had been doing this for years, probably a decade or more. The gland was still producing enough T4 to keep the TSH looking reasonable, but the conversion to active T3 was impaired, and the autoimmune inflammation was slowly destroying thyroid tissue. This is called Hashimoto's thyroiditis, and it affects roughly 5% of the population, with women over 50 being the single most affected group. 5% sounds small until you realize that's 1 in 20 people. In a room of 100 viewers, statistically, 5 of you have this right now and don't know it. Margaret didn't need an antidepressant. She needed her immune system calmed down and her T3 conversion supported. We started with diet, removing gluten, which in her case was a significant inflammatory trigger. We added selenium, 200 micrograms daily, which is the dose shown in clinical trials to reduce thyroid antibodies by up to 40% over 6 months. We addressed her vitamin D, which was low, 22 nanograms per milliliter when optimal is between 40 and 60. We supported her gut, and within 10 weeks, not 10 months, 10 weeks, she called her best friend for the first time in a year and talked for 2 hours. That's not a miracle. That's what happens when you treat the actual problem. All right, let's get into what you can actually do. This is the part where I give you the tools. No prescriptions, no expensive supplements from some wellness brand, just evidence-based, affordable, practical steps you can take starting today. Method 1, the morning temperature check. This costs you nothing and takes 90 seconds. Here's why it matters. Your basal body temperature, the temperature your body settles at during complete rest, is a direct reflection of your metabolic rate, which is controlled by your thyroid. If your thyroid is underperforming, your morning temperature will be consistently low. Here's how to do it. Buy a simple digital thermometer, the kind that costs $3 or $4 at any pharmacy. Keep it on your bedside table. Every morning, before you get out of bed, before you go to the bathroom, before you drink water, before you do anything, put the thermometer under your tongue for 3 minutes. Record the number. Do this for 10 consecutive days. If your average temperature is consistently below 97.8 Fahrenheit, that's 36.6 Celsius, you may have a functional thyroid deficit. This isn't a diagnosis, it's a signal. A signal strong enough to bring to your doctor and say, "I'd like a full thyroid panel, not just TSH." That thermometer gives you data. Data gives you leverage. Method 2, the selenium protocol. Selenium is not optional for thyroid function. It is the mineral that activates the enzyme, called a deiodinase, that converts T4 into T3. Without adequate selenium, the conversion stalls. Period. The richest natural source on Earth? Brazil nuts. Just 2 to 3 Brazil nuts per day provide roughly 200 micrograms of selenium, which is the exact dose used in clinical trials for thyroid support. Not a bottle of pills, not a subscription box, Brazil nuts. You can buy a bag at any grocery store for a few dollars. It lasts weeks. Eat them in the morning with breakfast. Chew them well, 2 to 3 per day. Not 10, not a handful. Selenium is one of those nutrients where more is not better. High doses can actually be toxic. 2 to 3 nuts every day. That's it. Caution: if you're on blood-thinning medication, talk to your doctor before starting selenium supplementation in any form, including food-based. Selenium can interact with certain anticoagulants. Method 3, the gluten audit. Now, I want to be careful here because I'm not one of those doctors who tells everyone to go gluten-free and pretend it's a cure-all. It's not. But here's what the research actually shows. In people with Hashimoto's thyroiditis, the autoimmune form, there is a documented molecular mimicry between gluten proteins and thyroid tissue. Your immune system can mistake one for the other. In these individuals, removing gluten for 90 days has been shown in controlled studies to reduce thyroid antibodies by 20 to 40%. That's a meaningful reduction. So here's what I suggest. If you suspect thyroid issues, especially if you have a family history of autoimmune disease, and autoimmune disease includes type 1 diabetes, rheumatoid arthritis, lupus, celiac disease, multiple sclerosis, try removing gluten for 90 days. Not 30, 90. It takes that long for the antibodies to shift. During those 90 days, keep a simple journal. Energy level from 1 to 10, morning temperature, mood, digestion. After 90 days, reintroduce gluten for a week and see what happens. Your body will tell you, loudly. The cost of going gluten-free in terms of basic staples, rice, potatoes, oats that are certified gluten-free, vegetables, meat, fish, eggs, is essentially the same as your current grocery bill. You're not adding anything expensive. You're subtracting one protein. Method 4. The stress-cortisol bridge. This is the one nobody in the thyroid space talks about enough. Cortisol, your primary stress hormone, directly inhibits the conversion of T4 to T3. But it gets worse. High cortisol doesn't just block T3 production. It actively promotes the production of something called reverse T3, which is a mirror image of active T3 that fits into the same receptors but does nothing. It's like a key that goes into the lock but doesn't turn. So now you have less active hormone and a decoy blocking the receptors. Double hit. What does this mean practically? It means that if you are under chronic stress, and let's be honest, if you're over 50 and living in the modern world, you almost certainly are, your thyroid function is being suppressed regardless of what your gland is doing. The gland could be perfect. The conversion pathway is being sabotaged by your own stress response. The fix is not reduce stress. That's useless advice. Nobody reduces stress because a doctor told them to. The fix is specific, timed nervous system regulation. Here's what I recommend. Every evening between 7 and 8 p.m., do 5 minutes of slow, controlled breathing. Inhale through your nose for 4 seconds. Hold for 4 seconds. Exhale through your mouth for 8 seconds. The exhale being twice as long as the inhale is the key. That ratio activates your vagus nerve, which is the main brake pedal on your stress response. 5 minutes, every single evening. The effect on cortisol levels over 4 to 6 weeks is measurable. Published studies show a 12 to 23% reduction in evening cortisol with consistent practice. That directly translates to better T4 to T3 conversion. This costs nothing. It requires no equipment, and it takes less time than brushing your teeth. Method 5. The gut repair window. Your gut lining regenerates every 3 to 5 days. That's fast, which means if you give it the right conditions, it can heal remarkably quickly. Why does this matter for thyroid? Because about 20% of T4 to T3 conversion happens in the gut. And because a damaged gut lining, what some clinicians call increased intestinal permeability, allows bacterial toxins to leak into the bloodstream, triggering inflammation that directly attacks thyroid tissue. The protocol here is simple. For 4 weeks, add these 3 things to your daily routine. First, a tablespoon of extra virgin olive oil on an empty stomach every morning. This coats and soothes the gut lining and provides oleic acid, which supports mucosal repair. Second, a serving of fermented food every day. Sauerkraut, kimchi, natural yogurt, kefir, not the pasteurized stuff, the live culture kind. The label should say, contains live active cultures. This repopulates your gut with beneficial bacteria that support the conversion enzymes. Third, remove or significantly reduce refined sugar for those 4 weeks. Sugar feeds the bacterial strains that produce the most inflammatory byproducts. You're not eliminating sugar forever. You're giving your gut a 4-week window to rebuild. Cost. A bottle of good olive oil lasts a month and costs a few dollars. A jar of sauerkraut costs even less. And reducing sugar saves you money. Let me give you the weekly structure so this doesn't feel overwhelming. Week 1 is your baseline week. Do the morning temperature check every day. Start the breathing exercise every evening. Buy your Brazil nuts and start eating 2 to 3 daily. That's it, 3 changes. Don't touch your diet yet, just establish these habits. Week 2, add the gut repair protocol. Olive oil in the morning, fermented food with 1 meal. Start reducing refined sugar. Not eliminating, reducing. Continue everything from week 1. Week 3. Begin the gluten audit if you suspect autoimmune involvement. If you don't have a family history or strong suspicion of autoimmune disease, you can skip this and focus on the other elements. Continue everything from weeks 1 and 2. Week 4. Assess. Look at your temperature log. Has the average shifted? Even half a degree matters. How's your energy on a 1 to 10 scale compared to week 1? How's your digestion? Your mood? Your hair? Write it down. This data is gold. This is the data you take to your doctor. Week 5 and beyond. If you're seeing improvement, maintain the protocol. This isn't a 4-week fix and forget. This is a lifestyle recalibration. The Brazil nuts stay. The breathing stays. The gut support stays. These become part of your operating system. Now, I mentioned getting the right blood tests, and I want to be very specific about this because if you walk into your doctor's office and just say, check my thyroid, you'll get TSH and maybe free T4. That's the standard panel. And as I've explained, that panel misses the most important information. Here's what to ask for. Write this down or screenshot this part of the video. Ask for TSH, yes, still useful as a starting point. Free T4, the unbound, available form of the storage hormone. Free T3, this is the one that matters most and is most often left off. This tells you what's actually reaching your cells. Reverse T3, the decoy molecule. If this is high relative to your free T3, it means stress and inflammation are hijacking your conversion pathway. Thyroid peroxidase antibodies, often abbreviated TPO. This tells you if your immune system is attacking your thyroid. Thyroglobulin antibodies. Same idea, different antibody target. And vitamin D as a bonus, because vitamin D deficiency is found in over 60% of people with thyroid autoimmunity, and it's cheap to fix. Some doctors will order all of these without hesitation. Some will push back and say TSH is sufficient. If your doctor pushes back, here's what I'd suggest. Be respectful, be calm, and say, I understand the guidelines, but I've been symptomatic for some time, and I'd like a more complete picture before we decide nothing is wrong. That's a reasonable request. You're not being difficult. You're being thorough. All right, let's bring this home. Here's your cheat sheet. The actions only, no repeated theory. If you're going to screenshot anything from this video, screenshot this part. Check your morning temperature every day for 10 days. Under your tongue, before you get out of bed, record the number. Eat 2 to 3 Brazil nuts daily with breakfast. No more, no less. Do 5 minutes of 4-4-8 breathing every evening between 7 and 8 p.m. Take 1 tablespoon of extra virgin olive oil on an empty stomach each morning. Add 1 serving of live culture fermented food to your daily diet. Reduce refined sugar for at least 4 weeks. If autoimmune thyroid disease is suspected, trial a 90-day gluten-free period. Request a complete thyroid panel from your doctor. TSH, free T4, free T3, reverse T3, TPO antibodies, thyroglobulin antibodies, and vitamin D. Now, when to see a doctor immediately? These are your red flags. Don't wait, don't self-manage, don't watch another video. Go. If you notice a visible lump or swelling in your neck that wasn't there before. If you experience sudden, unexplained weight loss, not gain, loss, especially with a rapid heartbeat, tremor, or anxiety, that could indicate hyperthyroidism, which is the opposite problem and requires urgent evaluation. If you develop difficulty swallowing or a persistent change in your voice, if you have chest pain or a heart rate consistently above 100 beats per minute at rest, if you experience severe depression, confusion, or extreme cold intolerance that impairs your daily function. These are situations where time matters. Everything I've walked you through today supports your body's own healing processes. It does not replace clinical evaluation when something genuinely needs to be examined. Before I let you go, I want to say something I feel strongly about. Nobody in a white coat is going to sit with you for 30 minutes and walk through the conversion pathway of your thyroid hormones. Not because they don't care, not because they're incompetent, but because the system gives them 12 minutes per patient, 60 patients a week, and a standardized checklist that doesn't include most of what we covered today. That's not a personal failure. That's a structural design problem. The system generates revenue from visits, prescriptions, procedures, and repeat appointments, not from teaching you how to eat 2 Brazil nuts and breathe slowly before bed. There's no billing code for that, and that's exactly why this channel exists. If this video helped you, even one piece of it, do me a favor. Hit subscribe, tap the like button, and send this to one person in your life who's been tired for years and can't figure out why. One person who's been told, your labs are normal, while they feel anything but normal. One person who deserves to hear this. You know who that person is. Send it to them. Because the system won't. But you can. I'll see you in the next one. Take care of that thyroid. It's small, but it's running the whole show.